Honourable Speaker, Honourable Prime Minister, Honourable Cabinet Ministers, Honourable Leader of the Opposition, and Honourable colleagues, I thank His Excellency for his most gracious speech. And this has indeed been an unprecedented year, Honourable Speaker. Around this time last year, the opening of Parliament, when I made my speech, we had measles, an epidemic, outbreak that started in Sero Namusi and a few other villages in Namusi and also in Itasiri. Honourable Speaker, we embarked on a public health intervention never witnessed before in this country, where more than 700 of our staff, with support from other government agencies, were deployed and immunized within 6 weeks. By the 24th of December, 500,000 Fijians, which included also a large number of adults, 33 children, most 33 Fijians, all children, mostly children were infected, and some required intensive care unit care, but none died. And in the midst of this, and taking a passionate approach to ensure that the large-scale deaths that our forefathers witnessed in 1875 is not repeated, and as you know, we think it's about 30 to 40,000, we did not know, or we knew, but only in slight ways, that the beast of COVID-19 was lurking offshore. Honourable Speaker, what happened next I will not dwell on, but suffice to say the following truths that I would like all of us to know. Firstly, for several weeks in the midst of COVID-19, I think it was in total nearly 8 weeks, there was comprehensive efforts. The Honourable Prime Minister and Cabinet colleagues would meet daily at the Ministry of Health headquarters to be briefed and provide the now globally reputable, recognized, timely and definitive decisions that has kept our nation COVID-19 contained, and the envy of many nations and many international experts. From Monday to Monday, inclusive of the weekend, there was meetings every day. This daily visit and briefing to the Honourable Prime Minister and the Cabinet and had the ability for the Ministry of Health staff to liaise with them personally and give them the signs, including our leaders from the West and the North, connected through Zoom. As you are aware, at certain stages there were lockdowns in both Sub and Lautoka. This also lifted the spirit of the Ministry of Health and Medical Services system and strengthened the resolve to protect this nation, because the leader was at the war room in Ministry of Health headquarters. Number two, the health system comprises of many components that form the whole machinery of health. It includes resources such as the human resource, the medical products and technology, health information, finance, as well as policies and processes. We have seen how first world health systems have succumbed to COVID-19. Our health systems took on measles, COVID-19, and the impact of 3 cyclones. This, Mr. Speaker, was in the midst of a global shortage of medicines, consumables, and equipment caused by this COVID-19 black hole. I call it a black hole, Mr. Speaker, because of the immense need created by it, where every nation, every healthcare provider is using large amounts of medical consumables, drugs, and equipment like never before. This has caused a strain on the global supply chain, even when we've prepaid well in advance for our equipment, medicines, and so forth. And despite our timely orders, the economy of scale works against small island nations. We've been blessed, though, because of our strong diplomatic position on the global stage, strengthened by the Honourable Prime Minister's global leadership in climate change, to draw on these resources in the midst of the COVID-19 black hole to continue to ensure that we provide our resources here at home. Number three, the criticism of the health system by the opposition includes the criticisms of every component of the Ministry of Health Medical Services, including its human resources. The sons and daughters of Fiji have worked tirelessly behind the scenes to keep Fiji safe. It is criticizing those who are exposed to risk, so they, the opposition, can walk around without a mask, not be at the risk of an ICU admission, and have their children and grandchildren go to school. This is not new to me, Mr. Speaker. The Honourable Biman Prasad and the National Federation Party had put in their webpage, and also it was published in the Fiji Times, that they wanted all civil servants to have a pay cut of 20%. Just today we've heard the Honourable Tambuya said that she's also saying that maybe we should be looking at cutting the salary of civil servants. How can they work? How can they work when their salaries are cut? They also talked about the rural lands. Let me tell you one thing. If we cut the salaries of a nurse by 20%, as they alluded to, that's 4,500. But the only thing that we've done for this year is taken away the rural allowance, which is 1,200. You do the maths. Which one is bigger? Mr. Speaker, sir, it is imperative that I shed some light on the COVID-19 pandemic. We know there's now nearly 70 million cases globally and 1.6 million deaths recorded. The number of new cases globally continues to increase with almost 1 million new cases in 2 days. In the Pacific, we've had nearly 23,000 cases with 240 new cases in the past 24 hours. To combat this, we needed great leadership and political will. And as I've alluded to, since day one, the Honourable Prime Minister has been at the forefront of policy decisions and support that is pivotal in the success of our COVID-19 containment. We've also had multi-stakeholder engagement. And this was initiated initially with the COVID-19 Incident Management Team and the General Manager, who is now the Permanent Secretary for Health. And it proved beneficial because it led to rapid and appropriate responses which protected the Fijian people. Mr. Speaker said, no country can say they are COVID-free until this pandemic is complete. And ladies and gentlemen, it's now been more than 240 days since Fiji's last community case. Today, the IMT now is still operational with the disciplined forces and weekly engagement from liaison officers, continues to lead our COVID-19 preparedness and response activities to the country. This same multi-stakeholder engagement is now proven beneficial in all the ports and our quarantine facilities. As you're aware, recently we've had 2 cases on board the marine vessel Island Chief has now more than ever shown that our machinery works. The testing, early warning, contact tracing, case management, and the secure and hygienic retrieval and isolation. I commend the effort of all our frontliners, including RFMF, border agencies, tourism operators, police, Fiji Airways, AFL staff, and the many others that I may not have mentioned. Some of them will be spending Christmas in isolation and quarantine, and this is a must so that we can have a safe Christmas. There are 8 quarantine facilities in Fiji, and currently at the moment we have up to 500 individuals in these facilities. We've tested more than 17,000 people, and the Fiji Center for Disease Control continues to operate day to day and testing, in some instances, nearly 300 tests a day. Honourable Speaker, to be really sure that there's no community transmission of COVID-19, they do not only test those who are in the border quarantine facilities, they also test those who are in the front line. They also randomly test those in the community who front up with fever. And so far, we've known that there is no community transmission. When we say we have no community transmission, we know it by science, not because we're just saying it for the sake of saying it. The Honourable Speaker, all the inbound passengers with medical conditions are communicated to the COVID-19 response unit, and the specialists are engaged from day one to ensure that their conditions are managed well during their days of mandatory quarantine. If there is forecasted possible events in the facilities, then these are mitigated to ensure that frontliners are protected during the response. Honourable Speaker, I'd like to talk a little bit about the immunization for COVID-19. Unprecedented resources are being expended globally with the aim of rapidly developing safe and effective vaccines against COVID-19. And as of November 2020, there are over 200 candidate vaccines, many based on newer but unlicensed promising vaccine platform technologies. They are in various stages of development with over 40 vaccine candidates in human clinical trials. The Fijian government, through the COVAX facility, has secured agreements for the supply of COVID-19 vaccines. But due to the different characteristics and requirements of each vaccine, they will still require specific programmatic requirements determining need. We are working with our Fiji National Inspectory Regulatory Authority and to make sure that we actually have efficacy requirements and WHO pre-qualification of the vaccine assessment program before we accept the vaccines into our country. Honourable Speaker, we are marshalling all our efforts towards the protection and safeguarding of our borders, and we will work simultaneously during that period in our developing a vaccination readiness plan so that when the vaccine is available, we'll be able to roll it out. Honourable Speaker, to ensure that we are COVID ready in our clinical services delivery provides patients with the best experience, the Minister of Health and Medical Services has invested significantly in the purchasing of equipment. We have now received our 50 purchased ventilators, 11 are now at CWM, another 9 in Lotoka, 5 in Labasa, and another one to the RFMF hospital. Honourable Speaker, the RFMF GNC hospital has been converted into a 5-bed intensive care unit specifically left aside for our frontliners. If any of our frontliners get sick and they need intensive care, level care, they will be taken straight to the GMC hospital, which now has a 5-bed intensive care unit. So we want to ensure that our frontliners are at peace, knowing that the risk that they go through, if God forbid they have COVID-19, there is a specified area that they will be looked in. We've also managed to buy vital signs monitor, patient monitors, infusion pumps, syringe pumps, and cardiac monitors, which was distributed in phases in our health facilities. The problem is they only look at the outside of the house. They don't even go inside and see the new equipment. Through the support of our donor partners, as WHO, we've also had 5 new biosafety cabinets and other equipments, including the US aid support through us with a Zolls ventilator, and also the airwalls, about 80 of them from the New Zealand government. Through our tender processes, in the last 2 months, we've been able to receive our dental equipment, new dental chairs, autoclaves, ultrasonic scalers, major radiology equipment, floor-mounted x-rays, digital-mounted x-rays, general ultrasound machines, and portable digital x-rays. We are about to receive 22 portable digital x-ray machines this week to replace the existing conventional x-rays in all the subdivision hospitals. Honorable Speaker, we will go away with a wet film. That will be no more. This will be taken with a digital format. That digital format will be available on the computer so the doctors can look at, and they can actually take a picture in real time if they need to, and send it over either by Viber or WhatsApp to the radiologist to be able to get a second opinion. And this is something that you cannot do easily with a wet film technique. Equipping our lab services, we've also received our arterial blood gas machines, urine analyzers, autoclaves, and centrifuges. And they are being installed as we speak. Honorable Speaker, with the implementation of the medical supply chain reform process that we are currently rolling out is a 15-month phase-out plan, which includes the installation of a new warehouse information management system to health facilities around the country. This project is supported by the Government of Australia, and in support of this initiative, JICA is also showing interest to help us with building new warehouses. Honorable Speaker, His Excellency talked about us being a regional leader in digitalization, and we must continue to leverage digital technology to improve the reach of government. Our health information system provides much of that information required to guide clinical management decision making. The need to find new ways of dealing with healthcare and having an effective service delivery. Having said that, the initial step taken by the Ministry was to bring all stakeholders and applications to address the COVID-19 threat without, and also assess the needs for digitalization and support for COVID-19 response. The primary response ensuring all the divisional major national facilities were equipped with internet and conferencing facilities that enable efficient communication with the leaders, UN agencies, and outside world in the height of the COVID-19 outbreak. Through general consensus, we also was able to purchase a software called SOMAS, which is Surveillance Outbreak Response Management and Analysis, or SOMAS, which we are now using together. As you know, we also have a Care Fiji app. SOMAS is a paperless solution and assisted with near or real-time data. It allows the application of linking tablets, health quarantine, control officers, surveillance officers, laboratory technicians, and the IMT. The way it will work, Honorable Speaker, if there is a community outbreak of COVID-19, again, God forbid, then the Care Fiji app will be able to identify those who have been in close proximity to that person. We will then load, when they've finally been called, we'll be able to load them onto the SOMAS and then be able to visit them and actually work with them in terms of case control. Honorable Speaker, this is all part of our Fijian COVID safe economic recovery framework, because we want to make sure it's a whole of a nation effort in keeping us safe, but also moving our economy forward. Honorable Speaker, I want to address the issue brought up by Honorable Geringen Tamboa on the Care Fiji app. Mr. Speaker, this antithetical statement regarding the Care Fiji app needs to be refrained, needs to be something that needs to be addressed and rebutted. It's misleading Parliament and the Fijian people, because we need to first understand the facts before speaking on a matter, because it is irresponsible statements such as this, questioning the COVID response tools. This is a COVID response tool that not only protects our people, but protects our frontliners, and only impedes the work of our frontliners and results in the escalation of fear, panic, and rumors in the community. Such statements, Honourable Speaker, are nothing more than politically opportunistic and nefarious propaganda of misinformation and cynicism. Mr. Speaker, it must be noted that the Ministry of Health and Medical Services has not yet counted this matter as an official border case. However, it is clear from Honourable Ngerengere Tambo's statement that we need to set the record straight again. Honourable Speaker, firstly, she said, the point that stood out like a sore thumb was that in the briefings by the Health Ministry, there was no mention of contact tracing efforts through the Care Fiji app to track down and isolate those who had come into contact with his health personnel. For the benefit of Honourable Ngerengere Tambo and everyone in this House, the close contacts are those who came into contact with a COVID-19 case. The 2 crew members tested positive for COVID-19 in this case. The close contacts are the 21 government officials who have already been identified and entered into quarantine facilities. Therefore, there was no need to track down those because they were already been quarantined. Like this border case, the government has set up rigid processes and the border officials are known to the Minister of Health and Medical Services. Furthermore, as the Minister of Health and Medical Services had confirmed, as a matter of excessively cautious approach, all government officials who had boarded the vessel had worn personal protective equipment as always and have already been identified and entered into the quarantine facilities. Honourable Ngerengere Tambo questions the purpose and the effectiveness of the Care Fiji app. The purpose of the Care Fiji app is simple and has been widely communicated. It is to assist contact tracers to slow down and stop COVID-19 transmission in the community. When there is a community transmission, when no one knows how that was picked up, that's the usefulness of the Care Fiji app. For those who are at the border, we know who they came in contact with. However, as the PS Health has stated on Sunday, the Care Fiji app, in addition to other measures, are to ensure that we are COVID ready. And that is critically important that every Fijian takes ownership in our national effort to contain the virus. We also have to know that New Zealand has rolled out a Bluetooth close contact tracing tool yesterday as the QR scanning tool rate had plummeted. Australia uses a Bluetooth contact tracing app. International experts and technologically advanced countries have time and again emphasized the effectiveness of contact tracing applications such as the Care Fiji app in controlling the community transmission of COVID-19. We are not doing anything that's unique. We are doing something that has been proven by science, something that top nations of the world are beginning to use and know that it's very useful in preventing the community transmission. Mr. Speaker, thirdly, the leader of the NFP talks about bipartisanship. And just yesterday he was speaking about collaboration. How can there be any collaboration if honourable members keep doing the dishonourable act of misleading this honourable House? Especially on a national health initiative such as Care Fiji, where every Fijian safety is at stake. Do not play politics with the health and safety of Fijians. Honourable Speaker, given the critical role, today Care Fiji app has been downloaded by nearly 90,000 times, and we have a 16.12% adoption rate. We need more, Honourable Speaker. We need more people to do this because it is protecting our community, it is protecting our frontline health workers. How can you say that you actually appreciate the frontline health workers and then at the same time you belittle an app that is important for their safety? Completely ironic. Zero. Honourable Speaker, we continue to remodel our health service. We want to ensure that we are working towards universal health coverage. Honourable Speaker, we are also working towards working with the private general practitioners because as part of universal health coverage, we want to ensure that everybody has access and working with the general practitioners in that regard, and there's already discussions happening. We're hoping to pilot it soon. Honourable Speaker, in our remodeling of our health services, we've identified a few things. Number one, we want to be comprehensive. We want to be holistic. We want to be integrated, enhanced, and fit for Fiji. We're taking CWM Hospital down to the health centers, down to Walilewu, down to Nosori, down to Wurindau, down to Kandawu. We were in Kandawu. We're taking Lautoka over to Nandi, over to Mba. And then we are expecting the health centers to then take their services down to the communities. And Honourable Speaker, I have with me here some of the subdivisions they've been doing outreaches. Ba, they did 15 outreaches. They saw 45,000 people. They went to 22 villages, 70 settlements, which is about 50% of the population of Ba. Sierra Namosi, they had 4,000, including the island of Benga. Bua, 14 villages and settlements. They saw 3,300 people. Rewa, 32 villages and settlements. Takunrobe, 7,000, more than 100 villages and settlements. Telebu, 52 villages and settlements. Honourable Speaker, we are not stuck in the health center. We are not stuck in the hospital. We are pushing out services to the people. And we know what the people need. We are taking it to them. They know because they've seen our presence. And we've been there with them. Honourable Speaker, we want to build a resilient health system. We want to strengthen our health workforce. We will continue to improve the service provision of our medicinal products. We will continue to improve our information systems, Honourable Speaker. Honourable Speaker, we are heading towards two things. We're heading towards the festive season. I have a message for this country. Please, in this festive season, eat right, diet and exercise. I want us to be a health-promoting country. Yeah. Let the religions and the churches and the temples and the mosques promote healthy living. Let the schools promote healthy living. Let the communities promote healthy living. Let all this intersect, Honourable Speaker, because COVID-19 has shown that those who are well and fit before they are hit by COVID-19 have a good reserve and are likely to recover. The second thing I would like to share with us, Honourable Speaker, there's also a time for disasters. And I want us to actually understand that we need to work together. We need to reduce the sources of leptospirosis, typhoid and dengue, which the health inspectors are doing an amazing job in working in that regard. Honourable Speaker, I wish you and the Honourable PM and Honourable colleagues a blessed and restful Christmas, and I'd like to thank all our staff in health, those on the front line and those who work hard elsewhere, so those on the front line can do what they do. Those in the clinics, the outreaches, the wards, the theatres, the administration, the supply chain, and everyone, I mean everyone, in Ministry of Health and Medical Services and our many partners. And thank you for being committed to the cause. We cannot drop the ball. We have to keep pushing for excellence. Merry Christmas, Honourable Speaker, and thank you for this opportunity.